planned 335 activities for Q1 in our area. Out of it, we were able to implement 36.6 activities. Activities that have been funded represent 37.5. Activities implemented 32.3. Activities funded but not implemented represent 5.3%. Based on financing, I already showed last night, the state funded stand at 84%, the partners funded stand at 6.2%, the conjoint funding stand at 17%, while the overall funding of our Q1 activities stand at 16%. The major bottleneck is number one, activities members not raised. Significant percentage of our program officers were not able to look at what we have in our state budget, right review and submit for review and approval, which represent 54.7%. That's one of the major bottlenecks. So I will call for the attention of our program line managers. As soon as the budget is passed, whether you are in the ministry, department, or agency, look at what you have as your own state budget allocation and engage your director or minister officer to see that raise the revenue. By raising the revenue, you as a program officer, you have done your own. Because if you look at the percentage, that not raising the represents 54%, which means you have a budget line, but you didn't even know that you are supposed to raise the revenue of that activity within the first quarter of our implementation. Incomplete activities that are funded. Some activity has been funded and funding was released, but implementation was not complete. Some of them because of the nature of the activity, that's why they are not complete. Some of them are like those that have reverse logistics of the implementation. Reverse logistics is not yet done, you can't see that. Sorry. And the next one, memo approved or delayed in approval of memo or delayed in release of funds. Where the government has several activities. Sometimes you see a program officers during our review, they were complaining that they have done all the directives and the memo was late and the principal officer has signed the memo and submitted, but the memo was not. Okay, sir. So that's another thing which means there is need for us to do what is referred to as buying or political will of the tough leadership of the state. The next one is execution yet to commence. We have which stand at 1.2%. Some activities have been approved, but they are not yet started while we are ahead of the queue. Even if it's about the end, but the activities are supposed to happen. Issue at the Ministry of Finance, which we need to also maybe engage in advocacy and participation to showcase to them why we put them to the cash budget. So based on all this highlighted, we have the following recommendation. Number one, timely release and utilization of funds. We need to, as I said earlier, get a good advocacy, develop advocacy sheet of our respective department or agencies, so as to see the reason why to get the political buy-in or buy-in for us to get that approved and released. And raise and approve implementation barriers. All of this at our level we cannot do it. What we can do is a showcase to the top management why His Excellency this kind of thing and why for us to implement it within the quarter and that. And the next one, improve the coordination of partners activities and mobilization of domestic funding. We have experienced a lot of competing engagement of partners. We try as we can join a partners coordination forum to ensure that partners activities do not clash. But despite that effort, we ended up having a lot of activities clashing with each other, which necessitated for us to review our coordination plan and see how we can avoid those clashes and competing engagement taking place at the same time. And then the last of it is enhanced community engagement, accountability, evidence-based planning. Whatever we do, at whatever level we do, that's why I'm very happy that directors of primary health care are here and our MIs are here. You are at the front line of our work. And whatever we do, if we do not get the community by it will go away. And you are the people that lead us to those communities. Ensure that whatever we are doing, we get the community by our WDCs are very active across our PSCs. Ensure that we engage them. Why we need to encourage them to go and look the open for approval. Let us encourage them to work together with them. We should work as a team rather than as individual entities. Because the more we work as an individual entity, it becomes very hard for us to achieve our set objectives. But let us work together with those our WDCs. And there are times that we as civil servants, we cannot push that particular approach. But if we engage our communities, they know the importance of it in their facilities. They know the benefit their communities stand to get. They can be able to follow up to the chairman, go to the state house, or go to any political agreement, so that particular funding or that particular agreement to their community is being executed. So no matter what we do, if we didn't get the buy-in of our community, the work is like we have done nothing. So please and please, I call on our directors, PSCs as our MI. Let be strategize. Let's go back to the drawing board. Ensure that whatever we are doing, our WDCs across our facilities are actively involved. Because sometimes some of the surveillance are by and somebody will go to a particular PSC without any community for that particular PSC. Which means the community will not carry along. You can't measure the satisfaction of service without involving the community people that are receiving the services. So a lot of times such things happen. And for us, the only way we can avoid work together with our community system. So that whatever is coming to us, they are aware. Because it's their own, it's for them. So that we can work together with them and ensure that we succeed. And sometimes when they are doing the assessment that is focused on the community, somebody will go and meet any person that is not aware of even the commodities available in the facility and asking the availability of commodities. That person will just tell him, I don't know. To him, he just said, no available commodity in the facility. That's what it will matter. I may be against a particular village. I don't know, I have never been to their facility. I don't know how the service is operating. And somebody will come because he's seeing that community asking the service of that particular place, of that community. And I will not say it to my mouth because I don't know what to actually do. So that is why we need to begin and ignite the energy of our WDCs. Ensure that whatever we are doing, members of our WDCs are well informed and are carrying along. Where we cannot push, let them give them the information, let them push where we can push. Give them the data where we cannot put anything, let them do. A particular place is reported about 3 or 4 United States. We say a particular country. It's alarming. What is happening? Maybe they lack basic education that need to be provided and it's not there. How can we get it? Somebody has already written the approval has not been given by the chairman. And the music chair of that one can speak to the music chair of the local government and can go and meet the chairman. Before you know that problem was solved, before the community is the capital. So sometimes our work is made by the system, but we are not operating in the system. Rather, we operate as an alone individual. Can you go to the last slide, please? So by and large, if we look at our performance, as I said earlier, which start all the 395 activities, out of them, only 36% of them were implemented in Q1, which is a very poor performance if we compare with the other states where they are set AOP Q1 performance. So what we need to do to ensure that we improve upon that is to prioritize the initiation of our activities. As a program officer, you cannot wait until somebody calls you about your program. It is you that are supposed to follow up about your program. You need to understand that you plan a particular activity. have put it in the budget, or a particular partner, whether you have planned an activity in the one, he gets that partner. You can remember during our AOP, social activities have been under my unit. What do we need from our own partner, state partners? Or what is it that we can act? Sometimes we wait.
Just make. This mic. This mic testing. This mic.
What I have to say is that we have seen our performance and practices. And we can see
start engaging the partners that are supposed to follow up. If it is joint, engage with your, at least you have done your own best. But by the time you send the AOP performance review to the national and see that initiation of memo is at 5% for particular quarter, you cannot blame the political leadership or the manager. Rather, you have to blame yourself, because that is you that's supposed to initiate the program to ensure that the program is being implemented, rather than wait until somebody asks you to come and initiate that program. So by and large, this is our Q1 AOP performance. And the reason we are showing this Q1 performance is based on the earlier presentation. We have seen how the national is looking at us based on different indicators. And as the ES said, we should look at ourselves first. Identify what is it that we have done wrong. By doing so, we can be able to improve upon those mistakes done in our quarter one. But looking at our own failure, look at that we will not be able to that our parents as well as the national, they always look at our performance based on the judgment of the partner. Want to see that there are huge amount of in ensuring that more and more women attend ANC. But by the time a data is presented at the national office of that partner, the has been pushed. You will see the one is at below 50%. No partner will appreciate that. So our MIE as the data gatekeepers, please and please ensure that we look at what is it that we have done wrong in our one in data. What kind of data are we going to do come from the national to assess us? What is the data that we are giving out? Because those data, the more they get to the national, we don't have to judge us based on, and we developed our AAP last year. The national is now performance forward. Well, in terms of our performance, they will increase our funding. If we didn't do well, they reduce our funding. It's a setback to us. All that we are doing it to improve the health and well-being of all Kebbi residents. Irrespective of your tribe or your religion or your background, we ensure that you get the needed health services that you need as at when you need it. So it is not because I am director planning or director at the local government. No. Look at the burden of responsibility on your shoulder so that you can be able to improve in delivering those responsibilities. Our directors, I know you are highly engaged, you are highly committed, but we need to redouble our efforts. This is the state data, and this data is based on what is happening in our LGS. So our performance for Q2 is very soon due, that we are going to review and see what we do in Q2. Our program officers, please and please look inward. Look at the budget, look at the AOP. What are the programs that you have planned? Have they been implemented? What happened? Why are they not being implemented? Because sometimes it's not the lack of funding, it's lack of a need for that particular activity. By initiating it, it's a performance based on the major maybe you have the memo for that particular sensitization, and you submit it, and your principal officer also submitted to the authorities above you. By doing that, they will rate you our performance increase. But did you initiate anything? No. Whether the memo is approved or denied or is not approved, it's not there. You cannot get any mark. But at least let us initiate. Let activities that we plan as well as in our priorities are many. But at least do your own work. Use data. Indices are we have access to our HIS2. Indices are there where you can show what is the level of our ANC attendance, actual. What is the level of our facility delivery? What is the level of our neonatal and maternal tests? Showing them this, the data can tell them that they need to do something. I hope you understand. Thank you very much. If there is any question you can ask, this is the end of my presentation. Last slide, please.
Thank you very much, Shamun. Can we have
last slide? Last slide.
Please.
Okay, somebody want to ask question? Okay, I should come. Okay.
Okay.
Okay. I understand.
Okay, thank you, Shamun, for the presentation.
Okay.
My name is Melissa Bello from Jaffa. From your presentation, I have seen that the performance for state is around 36.6. That's for quarter one.
Yes, sir.
Yeah, this is very much appreciable. But